Hello and welcome to the EuroHealth podcast. My name is Jiří Svoboda and this is season 3. Our guest today is Dr. Jane Mounteney, head of the public health unit at the European Union Drugs Agency. Doctor, welcome and thank you very much for your time.
Thank you very much.
So our main topic today is the agenda of the European Drugs Agency, which was recently in July evolved from EMCDDA, or European Monitoring Center for Drugs and Drugs Addiction. You've been part of this agency for last 14 years, which is almost half of its existence altogether. So just to give a bit of introduction, maybe to viewers and listeners unfamiliar with the agency, what is its purpose in, let's say, the metrics of the all the other institutions in the European Union?
Okay, thanks for the question. Okay, so the European Monitoring Centre on Drugs and Drug Addiction was actually established in 1993. And it was established in response to the, at that time, kind of heroine and HIV epidemics. And its purpose was essentially to try and bring European countries together to create a response to those problems. And it's had quite a clear remit, which was around information and monitoring, to try and develop some key measures and to try and ensure that the countries were creating a common language to try and understand what was happening and to get a common response to the problem. So as I say, at that time it was mainly heroin injecting, and also responding to the HIV crisis. Now, clearly the drug situation and challenges have changed over time since 93. The next step that the agency kind of developed was an early warning system on new psychoactive substances. So as the market started changing, we were seeing new drugs legalize. We established an early warning system on new psychoactive substances. It's a long name, but it's really been an important tool to try and respond as the drugs markets developed. More recently, I think we've seen lots of new and emerging policy challenges. We've seen a lot more developments in the area of highly potent synthetic drugs. We've seen polydrug use emerge. Stimulants have become more important. And part of these new challenges to the market have been the reason for establishing the new agency, which I think we'll move on to talk about, the EUDA, so the European Drug Agency, which became operational from 2024.
Mm-hmm, mm-hmm. You said that the main kind of reason for the establishment of the agency back in 1993 was the common response. Has the common response become therefore more harder altogether because of, as you said, the whole drugs situation has become much more complicated since that time?
I mean, I think we have made huge steps actually in the direction of a common response. I mean, through the work of the agency, one of the things that we've established is a network of focal points in each country. They're called the RATOX network, and each country has its own focal point. There's 27 in the EU, plus 2, which is Norway and Turkey. And all of these focal points work together to help us understand the European picture. And over the years, we've harmonized data collection, drug-related deaths. We've now moved towards a more common understanding of what these are, how many they are, the trends, what's happening with treatment and treatment demand, also prevalence, what's happening in terms of drug use patterns. So I think we've made actually an enormous amount of progress in terms of harmonization and standardization. But the challenges have actually led to us developing our methods in quite interesting ways. So over the years, we've brought in new approaches. Just as an example, wastewater analysis. So now, alongside our sort of surveys and our standard measures, we've got analysis of wastewater. We analyse syringes, what's being used in syringes. We get data from hospital emergency departments. So we've got a lot of new data sources from often city level that helps us understand what's happening.
Mm-hmm. That's very interesting that the work seems to become much more data-based and less just politics-based, let's say. But I was maybe interested in more in the area of you mentioned several points of measures that become more integrated. Would you say that there is still a lot of room to perhaps integrate in more different areas as well?
I mean, just to sort of clarify, our role has never been to make policy. It's always been to give a reliable, objective information on drugs so that policymakers can make good policies. And of course, core to our aim is to ensure that the information that policymakers are receiving is evidence-based. So in that sense, our role is for evidence-informed policy. So we have a kind of a support and facilitation role rather than a policy making role. But if you want to actually look at the evidence, in reality, most of the effective strategies to deal with the problems are about joining up. They're about people working together and they're about integration. So it fits very well.
So EMCDDA worked in its current form as a monitoring center, let's say, for 30 years. What was the trigger? What was the reason to establish EUDA as a European Union drugs agency?
Well, the actual mechanism was the European Commission undertook an external evaluation of the agency in January 22. And they made a recommendation that the agency's remit should be expanded. So it was a positive evaluation, but actually more was needed, if you like. And that more was needed to help address the new challenges that are posed by an increasingly complex drugs phenomenon and the emergence of new potent substances. And they said, you're doing well, but to stay fit for purpose, you need to expand what you do. So it was essentially the external evaluation, the Commission's recommendation that should happen.
Well, if the message from the Commission was you're doing well and we need you to expand more more on what you do, what were the most important points to extend the agency's mandate?
I think some of the key areas were around timeliness of intervention. So some of the new services and mechanisms that we are setting up respond to that. So there's new methods that are being developed and expanded. There's a new alert system which will allow countries to find out more quickly when problems and harms arise. There's a new threat assessment mechanism, so which allows us to investigate. So it's timeliness, and it's also the action, more of an action role in a sense. We from an information and a monitoring agency to having a more of a service provision and an intervention capacity, we are now able to make recommendations to support the country's threat assessments and make recommendations following up on a problem. And the other kind of areas that are key, we are giving an expanded role in terms of international work. So that's going to grow, particularly as the European borders and countries bordering any threats to Europe. So we'll be more engaged, I think, internationally, a closer role with civil society. So we're already engaging in new dialogues with civil society. So there's kind of quite a lot of different and a lot more support for member states in terms of policy development and the implementation of best practice. So we've got quite a few new tasks to follow up on.
It's a lot of work in front of you.
Yeah.
So we opened this season of the podcast with Professor Viktor Mravčík, a renowned Czech addictologist who also contributed extensively to the work of the EMCDDA.
Absolutely, yes.
And he considered, when we talked about the current state of drug policies throughout Europe, he considered the drug policies in the addiction-based policies in the European Union, in the member states, as highly fragmented. would you say that this is the case as well? Do you agree with this assessment?
I mean, I think it perhaps just terminology. I mean, the European countries have always had very different drug policies. So there is what's interesting is we do have a European drug strategy, an action plan, which all the countries have signed up to. It's from 21 to up until 25. So that's I would say that's unusual globally. So we are able, interestingly, to talk about a common approach. So there is, as I say, a strategy and action plan. All 27 member states have signed up to. Quite high level, but it's got a lot of, it's got a lot of detail in it. And one of the things that's actually particularly interesting is the European approach. Again, on the global stage, is a balanced approach, which is quite helpful when we're talking internationally. So the supply and demand are both seen as key components. But particularly important for Europe is we also have harm reduction as a component of our European drug strategy. And again, that's quite novel, and is something that's come a lot later in other countries.
Yes, harm reduction is definitely one of the most important terms, I think, in this topic in the European level. Exactly as you said with Dr. Mravchik, we talked a lot about harm reduction. That is, just to explain to viewers and listeners, it's a more liberal, pragmatic approach to drugs, which is not that much rooted in, let's say, idealistic approach that there is a possibility of world without drugs. Why, just to give a broader overview of your opinion on this, why is EUDA so much invested into this topic and promoting the harm reduction approach?
I mean, again, saying we would not promote one approach. We would look at all the approaches and look at what's the kind of evidence behind them. So in terms of monitoring, we would have harm reduction alongside prevention, alongside treatment, alongside social reintegration as kind of quite core approaches. So we would certainly support harm reduction where there's evidence, and there is a lot of evidence in the area of harm reduction. There's no question about that. So we would be presenting, what we know works and trying to ensure that there was as good coverage and as good information about that out in the world. And as I say, it's one of the core. We would see it as a core pillar. There's not a question. If you think back to when we were established, which was in relation to the HIV epidemics, heroine epidemics, that there was a quite clear, that what was needed then, and one of the core drivers was the harm reduction approach in Europe. So it's always been a European priority.
So you said there is an evidence to the fact that the harm reduction works.
Certainly. I mean, there's a very strong evidence base in the area of needle and syringe exchanges, particularly linked to opioid substitution treatment. There are areas where the evidence base is a little bit weaker, but developing in terms of drug consumption rooms, take-home naloxone. So there's lots. It's an area where it's not new, where it's known that approaches can be effective.
But you said that you would more likely to promote, let's say, a balanced approach, that harm reduction may not be always the one and only solution. So is that the case that the harm reduction is not always the answer when it comes to reducing the bad impact of drug usage?
I think it depends on your objective. So harm reduction will reduce harms. The aim sometimes with young children, if you're talking very small children, it probably to prevent them to start drinking heavily, or so prevention can have a role. If somebody's looking to address their problematic drug use or their addiction, then treatment might be a goal. So there are a number of goals. Social reintegration might be when somebody is looking to leave treatment and reintegrate into housing, into education, into workplace. So I think we would see there are different approaches and countries, and I think that's when use the word fragmented, I would say that they had different policy emphasis or priorities. And our role isn't to tell them what policy choices to make, but to make sure whatever choices they do make are informed by what we know works. Or actually, very often in the reality, there are big gaps in our knowledge, and to try and make sure that if people are operating in a grey zone where there isn't very much evidence, that they perhaps put some evaluation and some studies in place so we can all learn together.
Mm-hmm. Yet you said that in the beginning that like much of the drug policy has become more effective when it's coordinated in between many people, member states. So I would imagine maybe isn't that the case for the EUDA to perhaps actually talk more into the member states, talk more to them, to like tell them and coordinate more on the policies in the drug area.
Again, I mean, I think it's quite important. We're not policy making agency. We are an information and a monitoring agency at heart. So of course it's the national governments that will choose their policies. Our role is to enter into dialogue with people and try and ensure that what we do know, as well as what we don't know, that we get those messages across. So I think that sort of ensuring the science to policy, ensuring the communication, getting good, trying to make sure that our messaging is appropriate and presented to the right people at the right time, so they can make good decisions. That's in a sense what we're about.
So when you're talking, because together with Dr. Mravchik, he also is engaged in very much in these conversations with policymakers on different levels, and he said that he's often met with not really clear understanding of the harm reduction, and he's sometimes met with the fact that the politicians are really restrictive by default in the to use their words, fight against drugs. Is that something you also experience, or do you have different experiences with policymakers and the talks you hold about the drug policies?
I mean, we operate in very many international arenas, and as you can probably imagine, we're therefore interacting with a whole range of different policy approaches. And as I say, one of the things that we will be pushing for time and time again is the evidence. What's the evidence say? What's the evidence-based approach? Within countries and across countries, you've got a whole range of different political and ideological debates and opinions. And what we see is that, or what we hope is that what we can present and put forward is useful to support those debates going in the way of what we know works, and rather than the opposite. But in a sense, as you know, those decisions will be made nationally.
So when you have these political and ideology-based approaches and you have to talk with these people, what's your argument? How do you try to convince them that they should also look at the evidence side of things? Is that easy? Is that hard?
I mean, we're lucky enough because we've been working in a kind of a slightly an objective and a scientific way for over 30 years now. We have got to a large, or to some extent, I would say, a respect from many different parties. Whether we've got good links both to policy, to civil society, to different networks. It doesn't mean they always like what we say, because it doesn't always, perhaps help their aims or their advocacy. But sometimes they do. What I see is that we're called upon for a sensible view on things, and people will refer back to us. The European Drug Report is one of our major publications that annually says this is the state of play, these are the trends. We've also got a best practice portal where we show the evidence that comes from studies. We've got something called the European Responses Guide that is for decision makers and saying these are different approaches to tackling the problems, and this is what the evidence shows. So people kind of refer to us and use us, and the more we're known, people know we exist, they know how to access us, the better. So a lot of the work we've been doing more recently has been trying to reach out, and I think with the new agency even more so, just so that we can ensure that what we've got is available. And I mean, I guess we believe in the idea of policy windows, in a sense that there are sometimes times where people are ready to hear and to make changes and take the evidence, and other times when they're not. Doesn't mean it shouldn't still be there and generated, but sometimes there are moments when the world opens up and they say, okay, what is the reality there? And we say, okay, here we go. We've got some information on it. We have webinars on things people come and pick up. We do training. There are many different outlets. I think we have groups with policymakers who are looking at particular topic. We work with them, we share the information, we work with their questions. We don't tell them what to do. That's always been our our stopping point in a life, but we help them interpret it. And
would you say it's become easier in the recent years to convince politicians and policymakers based on the scientific evidence? Does the scientific evidence kind of come to fruition?
I do not know. It's a very good question. I think it's always been there's always been a scientific view and a political view, and occasionally they match.
Occasionally.
Whether it's easy, I'm not sure. Yes, I think we can say. I don't think any scientist would say that they believe that their results and their evidence is the main factor in a decision. It's much more likely to be public opinion, so we kind of recognize our limitations in that. I think it would be exciting, and perhaps what we're working towards is a bit of a new science policy ecosystem where we can look at some slightly different mechanisms to encourage that dialogue. But I think we win rarely, and this isn't just in the drugs area, in any area, scientists aren't so naive to believe that that their findings automatically translate into action.
I'm maybe curious more about the situation on the European level, meaning in the interactions with European Commissions as the executive body of the EU. Does the European Commission, according to your experience, take into account the expert opinions and the scientific evidence that you provide to them?
I mean, we're lucky perhaps to have a closer relationship with the Commission and a great deal of support. As I say, we were given this new mandate with the new agency comes, and this is from the Commission with their support. So we have 40 new posts that will be opening up. We have increased resources, so a greatly increased budget. So I think we're very fortunate to have a good relationship, a really strong relationship with the Commission at the moment. So I know that's not always true for all agencies, but in our case, we do actually have a positive one. So.
The reason why I'm asking is that when I looked at the rhetoric the European Commission often uses when it comes to drug policies, I saw a lot of words related to fighting the illicit drugs, fighting the drug trafficking. It's something that Viktor Mravčík in this podcast called like the criminalization of the issue. It really relates to the criminal dimension of the drugs problem altogether. Do you think this approach is helpful in tackling the illicit drug problem in the EU?
I mean, this is going back to the balanced approach, I think. And if you look at our agency, we've had a mission for a number of years, which is a more healthy and more secure Europe. And that, again, reflects that balanced approach. So there's always a part of drug policy that's around fighting. If you say, we wouldn't talk about fighting because we're an information agency, but it's about responding to organised crime. And responding to the criminal activities relating to drug production, drug supply. I'm head of public health, not my interest as such, but I recognise that that's also part of the issue that's interesting and important for countries and for member states. My specific interests are more the healthier Europe and ensuring that the public health messages are high on the agenda.
And are they, at least in the Commission context? compared to really the fighting with the drugs?
I think the European drug strategy stands as the best representation of the voice of European countries at the European level. If you want to look, so you'll get different announcements, and you've got different DGs that are working in the drugs area. Now our DG is DG Home, but we also work quite closely with DG Santé as well, and I do in particular. The European drug strategy again has these different components, which again I kind of come back to, and one of my particular interests of public health, and I'm unashamedly supporting that, and would agree to support many of Victor's ideas. I recognise that part of the strength is that we also have the cooperation across both the drug supply, and we do within the agency too. We've got a public health and we've got a security and safety unit, so we cooperate also internally across those areas.
So as we said, the EUDA now has a stronger mandate as compared to the EMCDDA previously. Still, the Commission proposed the primary reason for this bigger role during the external evaluation you mentioned in the beginning. It proposes because mainly the problems of the illicit drugs, but of course the drug space is a complex space altogether. Do you think is the right approach to focus solely on the illicit drugs for the agency?
I mean, it's not my choice. We do have, which is new, and much more focus on polydrug use. And I do think that's a recognition of the reality that the market isn't particularly in terms of consumers and people who use drugs, and also harms, that it's usually around multiple substances being used. Some licit, some illicit, often used together. The risks are typically around that combination of use. And when we see overdose, for example, it's almost never that there's only one substance that's found in the toxicology. But so the patterns of use, polydrug use, combinations of use, medicines as well, are often very much in the equation, is the reality. And the new mandate quite clearly specifies that we have a kind of a mandate, if you like, to work in the polydrug use area. So we'll be using that. So
is that something that the polydrug usage also relates to, usage of alcohol and tobacco and other illicit drugs, or are we talking just poly usage within the realms of illicit drugs only?
No, it's full range of substances. So it's where illicit drugs are used alongside other substances, if they're illicit or licit. So it's much broader. So it does obviously include alcohol, it includes medicines, it includes legal as well as illicit substances.
Later in 2024, the EUDA will organize the biannual conference Lisbon Addictions. That brings together the top experts in the field and promoting scientific debate. What do you hope to achieve this year? What should be the outcome for you, for the agency?
I mean, Lisbon Addictions is a really exciting event. And it's the fourth one. I'm just talking with my colleagues. It's something we organise along with three other kind of key actors, Portuguese CICAD, with the Addiction Journal and ICE Addiction Editors. But the focus of this year's event or the overarching theme is empowering the workforce of the future, which I think is really, really valuable. But there's also a few new other things happening this year, which I understand there's almost 2,000 registrations. So I think it's probably become the largest addictions conference globally, so it is a kind of very exciting. But they've got a dedicated program for early career researchers, which is great, and they've got bursaries for addiction professionals, so to help people come. There's about 120, I think, they're paying for to come. So it's a really truly global event. It's a connection space, it's a discussion space. Something about what are the edges, an opportunity to network and link I think there's about 12 side events going on around the conference, a sort of wastewater conference. There's a prisons health conference, gender meeting, symposium. So, I mean, it really is a truly sort of major opportunity to bring people together and sort of generate ideas, connections, a hub, shall we say. And it's addictions, as you say. You're going back to your last question. This is an addictions conference, not just illicit drugs. So there'll be gambling and gaming, alcohol. There'll be, a really broad and exciting range of topics,
which I think will ultimately help your mission to focus on the polydrug usage as well, right? As the EUDA
absolutely, yeah. And I think that's the best way for us to do it. It's not that as an agency we try and do everything ourselves, but it's really to work with expert networks to leverage that expertise that's already out there and bring people together to connect. And the Addictions Conference is an excellent opportunity to do that.
So it's already out there. So it's just about bringing those people into one place, right?
Trying to make the right links and contacts to make the next positive steps,
And I guess also coordinate maybe, as you mentioned, internationally more, as this is also one of the priorities for EUDA as it becomes.
This puts Europe on the international stage in a way. I think, that we're really showcasing a lot of the European research and knowledge and experiences on a global stage. So it absolutely works well.
Is there a way how EUDA can inspire in other countries? Perhaps you said that we have a pretty much world-class drug policies in the EU, but is there still room for inspiration from other continents, other countries?
I mean, one of the things that we do is we have a number of kind of core development projects that we fund, which is trying to support neighbouring countries. Whether in the Western Balkans, we work very closely and have for decades actually with countries in the Western Balkans. More recently in neighbouring countries both in the east and in the south, where we support them in terms of actually some is accession to the EU. Others it's more just sort of setting up some of the mechanisms, thinking about drug monitoring, thinking about maybe putting a couple of surveys in place, setting up some treatment guidelines, quality standards. So we've got quite a lot, and that work I'm assuming is going to expand in the future. So supporting countries together, also to think about evidence-based, balanced approach, etc., is core to our future work.
And just to close it off, as the EUDA kind of starts this new era when it's actually an agency and not just a monitoring center, what do you hope the agency will achieve in, let's say, next 2, 3, 4 years? What, in your view, are the key priorities the agency should focus on?
Yeah, and I like the word agency because it's got that action in it. So that it's a lot easier to say.
Definitely more than EMCDDA, yeah.
I know, I heard you practicing. I think realistically we're going to be doing two things at the same time, which is going to be extremely hard. We're going to have a transition and a development phase at the same time as hit the ground running. So there are a few services that we will need to get up and running very quickly, and I think that will be things like the drug alert system, the European alert system, like the threat assessment system, so we can undertake quite quickly some threat assessments, and also a network of laboratories, a European network of forensic and toxicological labs. Those things we're going to be moving very quickly to get going. And I think then there are other things that will take a little bit longer. So those will be, there will be more a sort of transition as we expand, as we develop and grow some of our monitoring, some of our best practices and our training offers. So there are, I think there will be almost, two paths for the agency and over the next years as we develop.
Okay. That was Jane Mounteney, head of the Public Health Unit at the European Union Drugs Agency. Thank you very much for your time and best of luck with the new era for the EUDA.
Thank you very much.